My name is Danny, and I am the care coordinator here at TherapyWorks. I am here with James Quinn, our doctor of physical therapy today,
Hey everybody.
and we are talking about vertigo and dizziness, which I know there's differences in between those. But I guess the first question I have is, what is vertigo and what causes it?
So classic vertigo, like truly vertigo. When we talk about vertigo, is really the spinning, the big room spinning. You feel like, oh my gosh, everything's spinning so much, and it's noxious and it's intense. I'm gonna go ahead and apologize real quick because my voice is terrible. Go Chiefs! But I think I was yelling too much and my voice is cracked. So bear with me, and I apologize in advance for that.
Show must
And
go
we'll see if I
on.
make it through this whole Q&A thing here. But I think we'll be good. Hopefully, you can hear me. What was the second half of that question, Danny?
What causes vertigo?
Okay, the most common cause by far and away, especially if we're talking about true vertigo, is going to be BPPV, or benign paroxysmal positional vertigo. That is, I think, it's by a landslide the most common cause. I think it's 90% of all vertigo or dizziness patients are going to fall into that category. So it's the most common thing by a landslide that we see for dizziness and vertigo.
Okay, okay. And how do you treat that? How do you treat BPPV?
The BPPV is all again it's paroxysmal positional vertigo. So some brilliant guys have come along and decided, watched and studied how fluid moves in the ear canals. BPPV is basically caused by a a movement or a transitioning of crystals or otoconia in the ear, and they're getting stuck either in the wrong position in the canal or getting stuck, like at the base of the canals, or even in a viscous fluid in the canal. So they can get stuck in different ways and in different positions. But by and large, the best way to treat it is to pick the right series of movements
Yep.
to reposition the crystal in the ear. So we're kind of trying to move the body to line up the ears and move the crystals back where they should go.
Wow. Okay.
It's crazy.
It
It's
is.
really fascinating to me. I love talking about vertigo. It's super interesting. And it's really amazing too in treatment because,
Yeah.
I mean, you can really help some people out.
Yes. What are some good ways to avoid vertigo? Like if you're getting spells already, if you're getting dizzy, how do you, I guess, keep them at bay or lessen them, or what are your thoughts on that?
So again, if we're dealing with a true vertigo or BPPV, I think essentially you have to get the initial treatment right. So you have to get things repositioned. Most of the time, it's not going to go away on its own until you do. It can, but usually you really need to get the positioning done. Once you've done the positioning and you've really given it 24 to 48 hours to set back into place, once you've had it, you're always at a higher risk.
Yeah.
That's just the truth. But usually you can do, a lot of times people that have it chronically are going to have it once or twice a year. It's almost always around like allergy season. So sinus pressure, ear infections, or pressure in that whole kind of sinus cavity can trigger symptoms. Basically, it changes the viscosity of the fluid in the ear. The crystals can start to move poorly or get stuck, and boom, you got another bout of vertigo. So staying up on your medication if you're taking any seasonal allergy medications. I think basically staying well hydrated. I mean,
Mm-hmm.
blood pressure and general fluid motility can be a big issue there. So staying well hydrated is really important. Some people know their clear triggers. Obviously, if you know your triggers, avoid your
Yeah.
triggers. The That being said, I always hate to have people living in fear of having a trigger, because really, if we're treating it right, you shouldn't always have to be afraid of a certain movement sending you into a spell for days of misery. So,
Right, yeah. And being a patient of James's myself
oh
for
yeah,
vertigo,
wasn't sure if you were going to talk about that.
I
Okay.
yeah, well, I think it's important. Spread the word. But certain positions, like when I would lean down to get laundry out of the dryer, that would always trigger my vertigo, or, getting up and down really fast, or sometimes rolling in bed to the right was kind of one that we had to work on, but that's what we went through in therapy, is doing those movements to kind of help me through my vertigo. I don't have BPPV. I have something else, but vertigo is vertigo. So
Right. So,
yeah.
well, since Danny brought it up, I assume she won't mind me talking
That's
about it
okay.
a little bit, right? So, BPPV is the crystals loose in the ear. Yours was more of a vestibular neuritis, correct?
Yes.
So, a little different. Obviously, vestibular neuritis is far less common. Lucky you, Danny.
Yay.
It's essentially just like it sounds. So, this is all nerves in the inner ear. So, it's an itis and it's an inflammation of the nerves. That can be brought on by uh, most commonly, it's going to be some sort of viral infection. Viruses kind of cross the blood-brain barrier. They trigger inflammation. The nerve gets irritated. In a case like hers, so you still have vertigo, but it's not necessarily going to respond as well as a classic BPPV. But there are things we can do to treat it. So I guess that's the long story short. That's the important takeaway here, is even though her symptoms weren't quite the same, through habituation or working on really testing and recalibrating the system, we can still have a positive impact there. So
Yep.
not it doesn't quite the same as a standard BPPV treatment, but you guys, if you're struggling with things more like that, we can definitely help you out. Sometimes it takes a little bit of we got to get our eyes on you to see what the underlying cause is, but that can be a secondary issue.
Yeah, and I can say I went through a period where I couldn't work, and vertigo was horrible. I don't wish it on my worst enemy, but PT really, really helped. It made a huge difference, because the first thing my doctor said to me was, you need to get out there, you need to start working with your eyes and your brain again, you need to work on your eye movements, and that's what we did in PT. So it really helped me a lot. Okay. Speaking of which, what are some stretches that you would do during vestibular rehab that would help?
So, you not always, but quite often there are neck pain and vertigo go hand in hand. There are a certain category or subset of vertigo that can actually be caused by neck pain. So I usually put these all together, because either you have patients that truly have a root cause being neck pain or neck muscle tightness, or a secondary result being neck tightness and pain. So I think just in general neck stretches. I mean, we usually will throw in a couple of our bulk muscles, like upper trap, levator, scap. If you can tolerate it, obviously, if you're at home just trying to pick up some of these exercises and you're struggling with a lot of acute dizziness, that can be really difficult. But keeping the neck loose is very important. Especially for someone with something more chronic like Meniere's disease or a vestibular neuritis, if neck pain and tightness is an issue there, or even visual fogginess, somebody that has this constant low grade dizziness. That's not true vertigo, but it usually causes a lot of neck pain. So again, general upper trap stretches. I mean, leaning to the side, letting that relax. A secondary levator stretch, rolling to the front. I know you can't see these too well on camera. But basically, not being afraid to move as long as it's not giving you acute triggers, and getting that neck moving in multiple directions and letting all those muscles stretch.
Yep, I was super stiff in my neck because I was scared. I was scared to move my head.
That's it. Well, you're miserable, you don't want to move, and then everything tightens up, and really that just makes everything worse,
it
right?
Does.
So we got to start unwinding those things.
Yes. Okay, and then what about exercises?
The exercises, again, kind of a little different depending on the case. So,
yes.
Everybody out there is like, "Ooh, this is right for me." It's a little tough to say without seeing you in person, so I apologize for that. Some things we can give these cookie cutter ideas, but I'll give you some general ones. Okay, the first and foremost, if you're having an acute bout, we have to get of what you think might be BPPV. You got to do the positional testing. You got to get that rectified. We can do visual drills and stretches all day long, and if you don't get the underlying cause, they're just going to make you miserable, and you're not going to actually help. You can't habitualize things if the underlying cause is still there.
Yeah.
So you take care of that. In your case, like the vestibular neuritis, you had to go down. You took some medication, right? So they get you on medication that downplays it. Then we can start attacking all these visual drills and stretches to start getting rid of the other symptoms. So basically, if you're looking at, basic exercises, I love eye drills and visual drills. The input into that vestibular system to retrain it, to remind it where it's supposed to be in space, to give it that input to relearn, after an onslaught of basically craziness to the system.
Yeah.
Yeah.
Gosh.
Did that answer the question, Danny? I
Yeah.
think that was I kind of
No,
went
it
off on a
did.
little
Yeah,
tangent there.
because I mean, it is.
But
It
I
is
love
broad.
visual drills and working on the eyes, working on tracking, working on near far gaze preference and gaze shifting. I think guys, you can play around with that a little bit at home. Don't be afraid to use those eyes because you might find it to be really fatiguing, but it's good to recalibrate the system. I think balance drills as well.
Yes.
Just we don't realize that our balance has probably gone to crud after a bout, and we got to resharpen that and make sure it's all working well. It all works together.
Yes.
And these little inner ear canals and inner ear nerves play a huge role in the whole system. So.
Yeah, and you don't even realize that until something like this
Yeah,
happens to you.
yeah. I'm like, Danny, try to stand on one foot. She
Yeah.
falls over. I'm like, oh man, we're in trouble. Okay.
Oh my gosh. Okay. Why is physical therapy so underutilized for vertigo?
I just think that people don't know. We think physical therapy. We think of musculoskeletal, knees, hips, shoulders, neck, back. People don't really realize that vertigo can be treated here quite well. In fact, I would say it's probably should be an early stop in a treatment for vertigo. Not only because of the repositioning things that we can do, but all the retraining.
Yeah.
Again, if it's musculoskeletal and it's muscular in origin, really working through the back of the neck with our hands-on treatments to get all those muscles to relax can be wonderful.
It
to help
is.
you kind of break through things. Yeah.
Yeah. Yeah, I went through it. I mean, when I started getting vertigo at first, I had never experienced it, and it was terrifying. I thought I might need to go to the hospital. I thought I was having a stroke. I thought I needed to be sedated. I was terrified. So having answers from them at my workplace was amazing. And yeah, that working through the neck muscles, you don't even realize how tight you are, but it saved me.
Guys, you think I paid her to say this stuff? I did not. This is a true story.
It's real, yes.
Yeah, I mean, it's crazy. I've had people come in wheelchairs because they're so afraid they're going to fall and their system is so messed up. Sometimes we get so lucky in one session that they're walking out feeling pretty good. Sometimes we don't get that lucky, but usually people within a couple of sessions are feeling significantly better.
Yeah,
so.
and I walked with a cane for about a couple of weeks probably, and then I felt like I had enough strength to, my balance was really bad, so yeah, I was walking like a baby deer for a little bit, but
You look good with the cane.
thanks. Okay, so how do I know if I should receive physical therapy for my vertigo?
If you have vertigo, you should probably, and you have not ever had any PT treatment, you should probably give it a shot. I do think a true vertigo, 100% we can have a massive impact. Even if it's not a true vertigo and it's more like ancillary symptoms of the vestibular system being off, we can really treat things like that, be it improved balance, improve visual input. I think more so now than I feel like I have in a long time. I have so many patients talking about like a visual fogginess, making them feel that they're kind of dizzy all the time. That's probably not a true BPPV, but it's something that we can try to habituate and try to retrain the system and recalibrate the system and really improve upon those kind of symptoms. So if you're somebody who has something like that, we can still have a good impact there. If you're somebody that has any consistent dizziness or vertigo that's episodic and you have a lot of neck tension, I know some of you out there might be able to even like reach back and touch on the back of your head and you're like, man, this is really tight. Not only that, but it almost sends like a little bit of kind of pain or a little, makes me feel a little uneasy. That in and of itself, that muscle group can be a big like cervicogenic indicator for, and definitely come in if you fit into that category. But anybody who has it and you've never had treatment, I think it's worth a shot. Depending on the underlying cause, we can have variant levels of assistance, but usually everybody's going to feel at least a little better, if not 100% better.
Yes. Awesome. Okay. So lots of great advice. Anything else before we sign off? Any last thoughts or anything about vertigo or?
If anybody's listening and struggling with vertigo a long time, I mean, I think Danny, as Danny said, it's miserable. I'm sorry. But obviously, if there's anything we can do to help, I would love to help. I do really enjoy the treatment of vertigo because we can have such a good impact,
Yeah.
oftentimes really quickly. Sometimes it takes a little more work, so I wouldn't promise anything I can't deliver. But I mean, if you're out there and you fit into any of these categories or something resonates with you of anything we talked about today, hey, come in at least. We can do a kind of assessment and see if it's something we can help.
I agree.
Love to give it a try anyway. So yeah,
Yes.
that's all. Stay hydrated, stay healthy, stay moving if you can.
Yeah. Okay.
I guess that's all, Danny.
Yes, awesome. Well, thanks for talking with me about vertigo today. Like you said, if you guys have any questions, feel free to call us. We do complimentary consultations. We love to chat with you, get you some help, okay? All right.
Awesome. Thank you, guys.
Have a good night.
Good night.